Heavy monsoon rains have led to floods and landslides in Sri Lanka, where residents remain under virtual lockdown against a third wave of COVID-19. The occurrence is not new. Monsoon rains almost routinely cause flooding and landslides in the country, but COVID-19 has compounded concerns. This year, the heavy rains have caused flooding in the Ratnapura, Colombo, Gampaha and Kalutara districts, and landslide warnings were issued to these areas as well as to Galle, Kagol, Mathura and Nuwara. Despite this, at least 21 people have died as a result of flooding and landslides. The Disaster Management Center says that more than 270,000 have been affected by the ongoing rains. Over 26,000 people had to seek refuge at 60 disaster shelters close to areas identified as high-risk zones. Moving families to such shelters usually means that a lot of people have to remain in close proximity to each other, raising concerns regarding potential COVID-19 risk.
ඒ කියන්නේ සෞඛ්‍ය අමාත්‍යාංශයට හදපු ප්ලෑන් එක නිලධාරීන්ට එකකුයි ඊට පස්සේ මේ ජනතාවට එකකුයි දෙකක් හදුවා. ගිය අවුරුදු 2020 මාර්තු වල. මේක කිසිම බියක් ඇති කරගන්න දෙයක් නැහැ. මොකද හේතුව ඒකට සම්පූර්ණයෙන් මේ ගයිඩ්ලයින්ස් අනුව තමයි හෙල්ත් ඉන්ස්පෙක්ටර්ස්ලාගේ ඒගොල්ලන්ගේ ඇඩ්වයිසර්ස් මත කොහොමත් එක තමයි මේ ඉවත් කරලා තියෙන්නේ. දැන්ට ඒක දැන් ආපදා ඉවර හින්දා ඒගොල්ලෝ වැඩක් කරලා ගෙවල් වල ගිහිල්ලා තියෙනවා.
Due to the pandemic, the DMC's annual response plan for flooding and landslides has been updated. Families living in high-risk zones have been requested to update their emergency kits with face masks and a bar of soap or hand sanitizer. The emergency kit must also include important documents such as birth, marriage and death certificates, academic certificates, land deeds, vehicle documents, sumworthy documents and others, national identity cards, passports, bank passbooks, medical documents, prescriptions, clinic books, etc., and medication, a water bottle, small electric torch, personal hygiene products, mobile phones, phone chargers, and a list of contact details, jewelry, money, and some non-perishable food. In the case of evacuation, families in dangerous zones will be sent to stay with relatives outside the zone instead of moving into disaster shelters as they did in previous years. Those in high-risk zones will be sent to shelters where social distancing will be a priority, the DMC has emphasized. Occupants will be required to maintain a 2-meter distance from each other. Public health officials will pay regular visits to both shelters and other locations housing evacuees. Precautions will also be observed when distributing relief to minimize the possibility of another COVID-19 outbreak.